I'm Nicolò Battisti. I'm a consultant medical oncologist at the Royal Marsden of London in the UK. I'm the past president of the International Society of Geriatric Oncology, SIOG. It's always a pleasure to come back to SIOG. This year we are here in Ghent to celebrate 25 years of the founding of the society, with so many experts and leaders in the field of geriatric oncology from more than 80 countries. One of the top priorities for SIOG is collaborations. This is something that we outlined very clearly in the Lancet Oncology paper published in 2021 by Martin Exman, one of our founding members and leaders, because this is something that we perceive as empowering and allowing us to enable various stakeholders to make meaningful changes at various levels, especially when it comes to policy work. For example, to influence and inform the establishment and the development of national cancer control plans. For example, this week we had the European Cancer Summit organized by the European Cancer Organization in Brussels on Wednesday and Thursday this week. And we had a beautiful stakeholder meeting there with the ECO colleagues and with policymakers from the European Commission and the Cancer Mission at European level, where we discussed how we can advance policy work and strategies to better inform cancer control based on the basic principles of geriatrics, how we can implement them in busy and increasingly overstretched healthcare systems. We also learned from colleagues from the EU Navigate project the value of patient navigation systems. Again, older adults are frequently falling through the cracks of very complex and fragmented systems. And this is something that we are really hoping to see more and more implemented across different healthcare settings. So we are very much looking forward to the collaboration with the European Cancer Organization to try and advance these approaches and engage more and more with policy work at European Union level. Another line of work that is being led by our policy committee within SIOG is engaging with the World Health Organization. We've been working with them for many years, holding, for example, 2 policy meetings at the United Nations in Geneva. Thanks to this collaboration, we also are in ECOSOC status with the United Nations. And again, this is something that we've been leveraging to try and implement better healthcare system, more focused on the aging of the general population in a more diverse range of countries. For example, if we think about high, middle, and low-income countries, how do we make healthcare systems more age-friendly to meet the needs of an aging population that we are seeing now also in a broader range of geographical areas? And how do we implement these changes in the context of resources that may be more or less in a different range of countries and geographical areas? So this is going to be a challenge for our community, and it's something that we are hoping to work on with the World Health Organization, with some collaboration that we are now discussing with the organization. Another priority for the International Society of Geriatric Oncology is making more progress and in research and design more meaningful, for example, clinical trials in oncology. We are very happy recently to sign a memorandum of understanding with the Cancer at Aging Research Group, which was one of the leading organizations in that advanced the field of geriatric oncology with fantastic research that we've also seen published over the last 5 years. And again, we are hoping that this will lead to increasing focus and attention on the need to design better clinical trials for this large, increasing, and sometimes forgotten patient population in oncology research. We're also very pleased to contribute when it comes to research to the work of the European Organization for the Treatment and Research of Cancer, EORTC, and contribute to the Older Adult Committee within EORTC that I'm sure many of our viewers will know is informing research strategies and clinical trials at European level initiated by investigators, again, to expand the evidence base in geriatric oncology. So this is very much something that we are looking forward to continue engaging with. So as you probably have figured out, we have a very busy work stream within on various levels within SIOG. But again, we very much value the opportunity to collaborate with a broader range of stakeholders to try and advance as much as possible our field, the geriatric oncology field, which is obviously mainstream for so many oncologists and oncology professionals, even if they are not necessarily realizing that they're predominantly seeing all the patients in their clinics.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.